Hello, I'm Cokie Roberts. For several years, I've been talking to people across the country about hospice. I've done it because I believe strongly in the hospice mission of enabling patients, families, and friends to face end-of-life issues with dignity and support whenever, wherever, and however possible. Now I'd like to tell you about a special hospice, the Hospice of Warren County. Over 20 years ago, a group of community leaders decided there was a definite need for a hospice presence in Warren County. Their efforts led to the formation of the program that has grown and evolved into the comprehensive Medicare-certified hospice organization that now benefits so many people. Today's Hospice of Warren County is comprised of a core of professionals who work closely with a dedicated team of volunteers. Under the direction of physicians, hospice nurses, social workers, home health aides, chaplains, counselors, and volunteers coordinate their efforts to bring the most efficient delivery of services possible to each patient. Sometimes, many times, that involves developing a deeply personal relationship with the patient, family, and friends. More often than not, the hospice volunteers and professionals become unofficial, but nonetheless accepted, members of the family. And just what kinds of services are delivered? Well, they include things like regularly scheduled nursing visits, 24-hour on-call availability of nurses, home health aides, appropriate diet counseling, medical equipment and supplies, social work services, spiritual and emotional support, supportive services. Now, what do we do? I mean, are they going to be able to cut this? Huh? Okay. Okay. Well, they include things like regularly scheduled nursing visits, 24-hour on-call availability of nurses, home health aides, appropriate diet counseling, medical equipment and supplies, social work services, spiritual and emotional support, supportive services by specially trained volunteers, and bereavement counseling and support groups. In addition to direct service delivery, Hospice of Warren County is heavily involved in public education. Throughout its efforts, Dr. James Drain, the internationally known biomedical ethicist, has held lectures and seminars for groups of healthcare professionals and the community at large. Ongoing public education programs help people understand end-of-life issues and the conflicting feelings they are likely to experience. When they find themselves in the traumatic position of losing a loved one, Warren County's young people and adults have a sympathetic and compassionate ear in hospice. Bereavement support from highly trained professionals is available to those who are dealing with loss and grief. I could go on at great length, but I trust you're starting to get the message. Hospice is a vital organization. At a time of emotional upheaval, it's a strong and comforting arm around the shoulder. Here's what some who have benefited from the hospice experience have to say. Hospice people, both professionals and volunteers, are here because they want to help whenever, wherever, and however possible. Won't you help them whenever, wherever, and however possible? Thank you.